All right, let's make sure everything works. So we'll be testing the audio right now. Confirming audio works. We still have a few minutes till we begin at 7:30. Just getting all this stuff sorted out beforehand. Wonderful. Oh, clear audio? Fantastic. So, as we wait for people to come in, I want to thank you all very much for your patience. And I think we need to do a lot more lives more regularly now because we are once again in a stage where there will be changes to the travel restrictions. Kyle, thanks a lot. Thank you for being so kind. Thanks for being here. Please call me David. If you have time, please subscribe to the YouTube because this will be probably our primary form of communication moving forward. We have one more minute till we begin. By the way, all this fantastic audio and visual quality is thanks to my partner, AJ, who is trying to give us a much more professional look. So thanks a lot to her. And if you can, please share this link with other people who you might find may need it as we move forward into a brand new host of restrictions. Okay, let's begin. Hello, everyone. My name is Dr. David Edward Poon, founder of the Faces of Advocacy. We were directly responsible for the changes to Canadian border policy in October of 2020, resulting in the extended family and compassionate exemptions. Our sole goal is to ensure the safe reunification of multinational Canadian families during the COVID-19 related travel restrictions and moving forward, focus on family reunification. Our hard work resulted in exemptions, and it looks like we're now hitting the end of those exemptions in January of 2022. So this video will encompass a number of topics. Number one, what current rules are set out for the exemptions when they're planning on expiring those exemptions. Two, Omicron. And three, we need to have a discussion about vaccination status and the level of conduct that we're having and discussion that we're having amongst ourselves regarding those who are vaccinated and those who are not. So, number one, today is November the 30th, 2021. So, as of today, short trips outside of Canada, less than 72 hours, will no longer require pre arrival testing to come back into Canada. So, as we have seen over the past few weeks, people were able to leave Canada, take a test within Canada, leave Canada, and then come back within 72 hours on that same test. Because that made no sense, they've now dropped the requirement for short trips less than 72 hours. What that practically means for people in Canada, it means you probably can go to the US for a weekend and come back without the need for a test in the US to come back into Canada. So far, it looks like the CBSA has been following that. We have had a number of complaints from the CBS officers for other issues, but the 72 hours for the most part seems to be something that they understand. Now, of course, it's only been the first day, so we're still going to see how that turns out. Now, the reason that we're having this conversation right now is as of January 15th, 2022, you will need to have full proof of vaccination in order to enter Canada. So, what does that mean? That means that the extended family exemptions that the Face of Advocacy fought for will no longer have any relevance because in 2022, if you are unvaccinated, you are unable to come into Canada even with our extended family exemptions, the IMM 006E. This is a concern for us because the extended family exemptions exist to show that family reunification is essential, regardless of medical status. Now, we'll get into the vaccination discussion later on. But there are many countries with poor vaccination rates, not from choice, but poor vaccination rates from lack of available vaccine. And while the government of Canada has expanded its list of acceptable vaccines to include Sinovac, for example, there are still other vaccines currently in development in other countries or that people have received in other countries, such as Sputnik, that are not considered fully vaccinated for the purposes of Canada. What that means is your loved ones in another country with a different vaccine or a different availability to access vaccines may not be able to reunite with you after January 2022. This is a concern. And so we will continue to press for the continuation of our extended family exemptions. If you're at this point asking how can we help, join us on Thursdays when we have Advocacy Thursdays, where we write our members of parliament for current asks and trying to deal with issues related to family unification. It's very simple. It's a one-click email. You're able to send it to your MP. Send it at least once if you can, because that would really help. Right now, with the danger of us losing our extended family exemptions, there could be other barriers to family reunification. We have already started to see them. That's our next topic, the Omicron variant. So, to recap, there is a new variant to COVID-19 that was found. Um, the origins currently are trying to be found out, but there are at least 7 countries that Canada has identified to have high rates of this Omicron variant. Uh, these countries in the continent of Africa are now currently on a travel restriction where you cannot enter if you're a foreign national Canada if you have been in those 7 countries in the past 14 days. As far as I can tell in my conversations with IRCC, and I reached out to Health today, it looks like the extended, immediate, and compassionate exemptions do not apply to this current travel restriction. The order in council has been published today, and it looks like there is no exemption at all for if you're married, if you're not married, if you're extended family, or if your partner is passing away. There's nothing there. And to me, that's horrific, given how hard we fought over the past year to bring families together. The minute they release a new travel restriction, families are forgotten again. Some of you watching this may only be watching because you're thinking of your own country and your own situation. And while I understand that, I hope you please consider the fact that there are a lot of people who may be suffering because the travel restrictions do not consider the plight of families again. And if you felt powerless last year and right now you're in a better position, imagine those who are feeling powerless now. I am asking you, please join us every Thursday on Faces of Advocacy on Facebook and send in your Advocacy Thursday letter. You can also follow us here on YouTube. Please subscribe because I worry that there will be further travel restrictions that will affect family unification moving forward. The reason I say that is the order in council does not actually specify which countries will forever be considered a hotspot. What that means is that list can change every day. So right now, the country your partner may be is not affected, but it may happen in the future. The restrictions coming in from those 7 countries not only applies to them not being able to enter if they're foreign national, but if you are a fully vaccinated Canadian or permanent resident, which means you are able to come back even if you've been in those 7 countries over the past 14 days, it looks like you'll be subject to a quarantine facility. And that's something that the Faces of Advocacy fought very hard to stop last time. We got to the point where we actually issued a charter challenge, a legal action against the federal government because of the issues that have occurred. If any of you are watching this now who will be subject to this quarantine facility, I ask you to please reach out to us at Poon at facesofadvocacy.com. Poon is my last name. at facesofadvocacy.com because we may expand our existing legal action against the government. We want to know your stories. And the fact is, right now it's 7 countries, but who knows where it expands after that. In addition to that, and this applies to every country in the world except for the US, any person coming into Canada, regardless of vaccination status, will now be subject to a on arrival test coming into Canada. Now, this is something that the federal government's own scientific experts have said is not necessary for those who are fully vaccinated. Now, of course, during that same report, they mentioned that variants of concern may change things, and it may turn out that Omicron is subject to something that we need to extra test for. But this is a change that we don't know necessarily who's going to be paying for these costs. We don't know if it's going to fall into us. And at the moment, it doesn't affect those flying in from the United States or driving in from the United States. I once again stress to you all watching, particularly if your loved ones are in the US, remember how powerless you felt last year? People need your help now because the barriers to family reunification may get worse. We have gained a lot of ground over the past year, and the sheer fact that the current order in council does not have any exemptions for family unification is completely terrifying because that means all the ground we gained was completely forgotten by whoever wrote this order in council now. Some of us will be affected now, some of us may be affected later, but all of us should be standing up and pressing forward on principle. So please join us on Thursdays, our Advocacy Thursdays, to actually write these letters to your members of parliament because there could be a lot more coming at us. So before we go on to our next subject, just to recap. As of today, November 30th, short trips outside of Canada, less than 72 hours, will not require testing by the person leaving Canada, either in the country they arrived to or in Canada itself. So no testing essentially for 72 hours. Short trips. Starting in January 2022, the 15th, I believe, the only people allowed to enter Canada will be those who are fully vaccinated. Um, that means our immediate extended family and compassionate exemptions appear to be gone at that point. That is a grave concern to us because family is essential, and there are many countries in the world where there's simply a poverty of vaccines. The lack of compassionate exemptions is also a concern because we fought hard to not have another mother die without her children beside them. Um, in terms of the Omicron variant, this is now going to result in any person coming into Canada to require a post-arrival test, and those coming in from countries that are labeled hotspots of Omicron will, it looks like they'll be undergoing quarantine facilities. So this is something that could affect all of us depending on the list of where the Omicron variant is coming out from. So I'm going to now go into the next section. And uh, it looks like there's some comments here. My apologies. Let me take a look. Talk about professional looking video. Looks great, David. Well, thank you, AJ, for pulling that one together. You did a fantastic job on this, my love. Ouch, no family exemptions again. So right now our family exemption exists and it'll continue to exist until January the 15th. However, it looks like the family exemption does not exist for the countries that are affected by the Omicron variant. So the current order in council that was just released about the Omicron variant has no exemptions for immediate, extended, or compassionate reasons. That's quite a concern, particularly given that I suspect many family members will be willing to isolate and follow public health protocols, even when fully vaccinated, in order to prevent the spread of Omicron. Someone writes, so sad the government has not learned. Honestly, it's heartbreaking. Yesterday, I was coming upstairs, coming back home, and it occurred to me, I feel like a complete failure for not being able to have kept our extended family exemptions for longer than a year. It was only October we won our exemptions. It's October of 2020. It's now November of 2021, and the next order of the council has completely forgotten families. It's very upsetting. Um, Next question is, I am vaxxed with Sputnik and you are a US citizen. My fiance is in Canada. We applied for family unification in August and were able to see each other. So as of January 14th, we are back to square one. Yeah, and I'm really upset over that because people with Sputnik got the vaccine that their government was able to provide. It looks like the World Health Organization has yet to approve or authorize Sputnik. I speak to you always, not as a doctor with public health training, but as a person leading the founding faces of advocacy. So I won't get into the science of it. But the sheer fact that Sputnik, amongst, from my understanding, other vaccines that may come out, are not yet authorized by the WHO, you need a path to family unification. Um, Whether or not Sputnik meets WHO criteria will not matter as much because under the family unification, sorry, the family exemptions, you would have to quarantine in Canada for 14 days anyway. So you would still be isolated from other people to stop the spread. I'm very upset and I'm so sorry this is happening to you because you did your part, you got vaccinated with Sputnik, and there's no pathway to family unification for you after January the 15th. In fact, you know what? Contact me. Email me your story. Let's bring it into the media. My email is poon@facesofadvocacy.com. Poon@facesofadvocacy.com. If anyone has a story who will be affected by this, please reach out to me because we were able to succeed last time by putting the faces in front of the media. It's time for us to do it again, it looks like. Thank you, Vera, for being here. Great job, AJ. Not a failure. We need to keep the government accountable. We need to continue to fight for all families. Um, we worked very hard for these exemptions and for the exemptions to be largely forgotten when the next order of council came in. It's certainly something that bothers me. We'll continue to press forward. Please join us on Advocacy Thursdays, formerly Reunification Thursdays. Um, and please spread the word that if people are suffering, being separated from families, join us at the Faces of Advocacy. Um, Big shout out to the person currently writing our Advocacy Thursdays, our Director of Operations. Thank you very much for always keeping the letters so to the point, so forward, and so easy to spread. Can you get a new exemption approved before the 15th and enter Canada before January 15th if unvaccinated? You can still get those exemptions. The exemptions have been largely delayed. However, you are still able to get the exemptions. If you have been significantly delayed in getting your extended family exemption, please contact me, poon@facesofadvocacy.com. Poon@facesofadvocacy.com. All right. So let's talk about vaccinations and being not being vaccinated. So there are a number of issues that has come up in the Facebook group and how we treat each other. I think it's very important for us to treat everyone, regardless of their medical choice, with at least some sense of politeness in our Facebook group. I understand everyone has their personal opinions. I understand that it's a very charged subject, but we cannot be painting entire groups of people as ignorant or selfish or other harsh terms when that simply cannot be the reality. Um, so I understand that there's a picture of those who choose not to be vaccinated that has been maybe put into our ethos, our impression of people. But I would like to talk to you a bit about vaccine hesitancy and why some people have been hesitant to get vaccinated. And this is one of the rare times I will speak to you as a physician with public health training. When the vaccines first were coming out, I was told that uh, a particular group of disenfranchised Canadians, a racialized disenfranchised group, when they were offered the vaccine, they said, oh, they're going to test it on us before they test it on the white man. And that really shocked me. That was very scary. There's another disenfranchised group um, that it's very difficult for them to find vaccine centers that are appropriate for their culture, within their work time, within the ability to actually get there and get childcare at the same time. A number of barriers. This was told to me by one of my bosses. There's also a number of people who, rightly or wrongly, are afraid for various reasons, and they are not setting out to say, "Oh, it's poison. The vaccine is dangerous." These are people who are genuinely afraid. They're worried about rumors and information that has been spread out, and it's difficult sometimes to terse those two things differently. So that's not even including the people who are considered unvaccinated uh, because their country was unable to produce enough vaccines, unvaccinated because they had other barriers to it, such as concerns about their own health, and there are only two medical exemptions. All of that being said, it's very important to understand that when you talk to someone, it's not something that you should be saying, "Oh, you're ignorant. You're a selfish person. You don't know their personal history." There are a number of people in the group who appear to not be vaccinated, and it's important to check those barriers, see maybe what's preventing them, maybe help if you can. But if your position is simply to make them feel bad, that is not going to be a method in which to change minds. Now, on the other hand, there are some people who have chosen not to be vaccinated, and I understand it's your personal choice, but you cannot perpetuate myths and incorrect information about the vaccine. I understand sometimes it's very difficult to know what's accurate, but if someone is showing you data opposite to what you are saying or what you are feeling, I am begging you, please don't fight back and say my source better than your source. Disengage. But the position of myself, the position of the medical community, the position of the faces of advocacy is that vaccines work. I understand if you have personal reasons not to get vaccinated. I am just begging you to not perpetuate any falsehoods about the vaccine in our community. It is not helpful. It is not true. And it can harm a number of people. I cannot make that more clear. If you are still hesitant to get vaccinated and you have worries and you have concerns, you are still free, of course, to stay, get the support from the community. I'm just asking, like we have since the very beginning, to not debate the science. So when it comes to the place of are we going to help those who are not vaccinated, I already have told you that we will continue to press forward to secure the extended family exemption. There are a number of people who are unable to get vaccinated due to vaccine poverty. There are a number of people in particular circumstances, such as with this Omicron variant, that may need it. There are those with Sputnik and other vaccines who won't be able to come to Canada. They need the extended family exemption. Yes, this will apply to you, but if it is a discussion on whether or not you should be forced to take a vaccine or the vaccine is dangerous, I do not want to have those conversations within the faces of advocacy, and I'm asking you to please take those conversations elsewhere. So, with that being said, I think it's time for us to have a talk. We can have some question and answer. There's a principle in public health that your right to life and my individual rights end at the intersection of my fist and your face. So the basic idea is you can do whatever you want, but if you hurt another person with your fist or your health status, that's when individual liberties can start to be encroached upon. COVID is transmissible. COVID can harm other people. I understand some of you will be saying, well, then why are there so many increased numbers of COVID cases amongst vaccinated? That's because more people are vaccinated now. There's so many people being vaccinated that the few cases of COVID that break through will, of course, be under those who are vaccinated. It doesn't mean the vaccines don't work, and it doesn't mean the vaccine isn't safe. I understand that you have hesitancy. Please speak to your family physician, speak to a trusted person who's knowledgeable in science. Please find a way to address those fears. If those concerns are still there, I ask you please just do not debate the efficacy of the vaccine amongst us. Okay. Looks like someone was able to get their extended family exemption uh, within 5 hours. Wow, fantastic! In the middle of November. Are any new exemptions given? Yes, it looks like they'll be given, but I cannot tell you when they'll stop. But as of right now, January the 15th, 2022 is when that's the end of the extended family exemptions as we know it. And it looks like we're going to have to be pushing for it. Someone's writing, I'm trying to comment test. The test comment has gone through. Okay. So I'll leave this open for another 30 seconds, and if no new comments come in, I'll thank you all very much. I'm please asking you to join us every Thursday. You can find us on Twitter, Facebook, Instagram, Faces of Advocacy. We post a letter every Advocacy Thursday, which is very easy to do. Press a button, an email will be sent to your member of parliament and to the relevant ministers to advocate for families. Omicron will change a number of things, but it doesn't change the fact that families need to be together. A suggestion would be to write down the editor. Sorry, a suggestion would be to write to the editors in media that they will have to publish. Many aren't aware of how families are impacted unless they are directly impacted. All families are important. So Pamela, I don't know when you've joined us, but Faces of Advocacy has its namesake from the sheer fact that we put the stories, our faces, out there. And we've been doing it. In fact, we did it well enough that we succeeded at changing government policy only a year ago. And now with the new orders in council, we've been forgotten. Now, it's possible that once the characterization of Omicron has been shown to be not more dangerous than the current strains of COVID or Delta, the there may be extended and immediate and compassionate exemptions given to these scenarios. But at the moment, it's not there. And that's really upsetting because we spent all of last year showing them why it was important to do. I'm very irritated right now. Sorry, just got out of the shower, missed a lot. I'm really scared about impressing quarantine. I live in the States. It's not affecting the States right now. It's affecting 7 other countries right now. And we have to get out in front of it right now before a lot more families are kept apart. So Claire, join us on Advocacy Thursdays. Thanks, David. So clear, we have to look at what unites us, and everyone has the right to believe what they want and debate it, but Faces of Advocacy is not the place. We must not miss our focus. Okay. So if we have no more questions, thank you very much for joining. Please send this YouTube link to anyone you think it would help, particularly those who feel forgotten when it comes to their particular issue if they are unable to get vaccinated. Please send it to those who are vaccinated with Sputnik. Please send it to those who are vaccine hesitant. Please send it to those affected by the Omicron variant. And please send it to those who believe that families should be together. I can be contacted at poon@facesofadvocacy.com. Please send me a letter if you have been affected by the new travel restrictions. It looks like the government forgot us, but we're not going to let them forget us again. Thank you, Sydney. She's essentially one of our newest team members, and she's just been awesome. I haven't yet given her a proper title. I'm not convinced I ever will. Um, Today she is the director of hashtags. Um, Amy Rockwood, one of our donors who has been consistently so good to us, writes, should we be advocating for global distribution of the vaccine and our family members who are able to get in the US able to get vaccinated here? Should we be advocating for global distribution of the vaccine? I think any individual can advocate for that. Faces of Advocacy, because it's difficult to get attention as it is for our main issue, which appears to be forgotten in the past week, we'll stick to our current family unification. However, to any of you who are in positions to be able to speak to their ministers, or when you send your advocacy letter on Thursdays, write in, is there a way for Canada to help other countries get vaccines? Canada has contributed to COVAX, and interestingly, I think we actually got some vaccines from COVAX, which were meant for other countries. Um, the distribution of vaccines has not been equitable. There is a huge issue, particularly from those from lower income nations, and we see what happened in in countries that have not been able to have vaccine. Suddenly, variants and mutations occurred. The second part is, and our family members who are able to get to the U.S. able to get vaccinated here? I'm sure, I don't know if someone else in the chat can answer this one. Every province has its own guidance. Um, I know that there are those who are international who have been able to get vaccines here. I know I went across the street and I asked the pharmacy if an international person without OHIP, without the Ontario Health Card, could get it, and they said no. But there are clinics that do allow those without documentation. However, you should read the guidelines of your province, and you should not act in any way that goes counter to that. So there are two parts to this question. Is one able to? The answer is yes, but are they allowed to? The answer might be different depending on your province. Um, oh, wait. The question is families who are able to get to the U.S. able to get vaccinated here. If the question is, can you get vaccinated in the U.S.? I mean, I got vaccinated in the U.S. I was there in New York during my master's, um, but I was allowed to. I know the U.S. though has also been very, yeah, generous is the word, to those who are in the United States without proper documentation. So that's a separate conversation, but in the U.S. there appears to be a plethora of vaccinations. Thank you, Justin, who has been keeping us very well put together when it comes to the Face of Advocacy page. Uh, some of you might have noticed that there has been some less than encouraging discourse on the Face of Advocacy page, but we're trying our best to be fair. And honestly, we just draw the line at fake science. Uh, your personal opinions, for the most part, we keep them. That and no insulting each other. We need to advocate for all countries. That's why important we send emails. Thank you, Marcella. Um, we do need to advocate for all countries. Um, and Kara, who is also one of our newest teammates, you've done a fantastic job keeping us organized in general, helping me with my paperwork when I completely lag behind it. So thank you, Kara. Um, all right. So take home points. Thursdays, send your letter. We have a very small amount of letters being sent. I have a strong suspicion it's because a lot of the countries have exemptions coming into Canada. Well, now we're starting to see those exemptions go away. I'm begging you, please be here for all of us. Um, if it helps, I mean, my partner AJ is less than a meter away from me. She's been with me for most of the year. We're still at this. I'm not saying this to say, oh, look at me and my partner's here. I'm saying it at this point. A lot of us are doing this not because of our own personal situations, but because we saw how bad it was for others. So please be here on Advocacy Thursday. Jessica, advocating for not mandating the vaccine isn't fake science. Mandates should be vaccines should never have determined if we can see our loved ones. So this is a very important conversation. So I was referring to specifically debate on whether or not the vaccine works. However, the discussion on whether or not things should be mandated is actually a very reasonable discussion to have. I have seen some of the discussions, and some of the discussions veer into debating the science. But if it is a discussion and debate on civil liberty, I mean, I don't like seeing it. As long as it's polite, it can happen. But I understand completely that there's a concern about why there's a mandate. With the extended family exemption, there was a path for those who could not get vaccinated coming in. So if your question is, why don't you worry about those who can't get vaccinated the way that Canadians want it? I'm worried about them. As of January the 15th, those exemptions are gone. If you're saying, well, why can't someone come in and not quarantine if they're not vaccinated? The science says that you can still spread. If you're saying, well, why can't you board a plane if you're not vaccinated? The science is if you're on a plane, you could spread. If there was planes with with no way to spread each other, some sort of like individual helmet, maybe we'd go that direction. I just cannot find a science-backed way to get around that plane mandate. But from the beginning, an individual car, we have pushed for it. We got the compassionate exemptions. We got the extended family exemptions. we're doing the best we can. The discussion on mandates can occur. Just do not debate the science. All right. Wonderful to see you guys. Please send me an email if there are major concerns or stories you can bring up because we can bring them forth to the media, poon@facesofadvocacy.com. If you're able to, you can donate to us at buymeacoffee.com/facesofadvocacy. And irrespective of that, begging you, Advocacy Thursdays, go to Faces of Advocacy, send our letter. Please help families reunite. What if government listened? All right, catch you guys around. Thanks so much, guys.